There's one other thing. I'm really sorry it's a distressing subject again, but it's about the scenario of if you actually passed away and your heart stopped, whether you'd want healthcare professionals to use quite strong measures to bring you back, such as ventilation and blood. So ventilation being a tube down the throat and needles.
No point. You've already gone, really.
So, I mean, do you mind me telling you what I think from a medical perspective about that? So it's actually a medical decision about whether we start someone's heart again if it's stopped. But in your case, because of how many admissions you've had to hospital, how your physical resilience and strength has gone down on a background of all your medical problems, if your heart did stop, chances of restarting again would be very small.
Of course.
But more importantly, if we did restart it, your quality of life would be quite poor, very poor. And I don't think you would get much enjoyment from life.
No.
And actually, by putting a certificate in place to say not to restart your heart, we're actually giving you an opportunity to pass away naturally with dignity.
Well, it should be like that, really, shouldn't it? I mean, it's lovely if somebody's young, of course, it's important. You wouldn't want them to lose their life, but, at my age.
Your life is important, very important. It's more sort of about stopping you from suffering or getting unnecessary things that won't be pleasant and helpful.
I mean, you tend to think, when you're getting on a bit, that people, they just don't really want to do anything about it. You sometimes get, or you're getting on a bit now, you're old, and you I don't know, you just feel a bit unimportant sometimes.
Definitely are important, but I think that's more, in a way, that's why it's so important to talk about this, because I don't want you to go through something that's harmful potentially to you and and what it is to be you, which is, the things that you enjoy from life. I don't want to take those all away from you.
No.
So I want you to try and enjoy the time you have and not have things that are not going to help.
Yeah. It doesn't help that I've got loads of things that, aren't exactly right with me, but I know, medication, all that sort of thing does help, of course.
So there are some services. Now we've talked about a few things about what your care would look like. Yeah. There are some services out there that I can talk to you now about, which could help. There is a 24-hour nursing service, can give you advice over the telephone day and night.
Okay.
And they can visit if you feel unwell. And I can also arrange some other treatments that I can discuss with you on our next visit about how they can help you at home. And we can have a look at how your life is at the moment and keep monitoring you from a GP perspective.
Yeah.
And I'd like to see you in a week's time to go through this again, perhaps with your son, and give you a chance to just digest the information.
That's a good idea, because he'll remember more than me. I mean, I am listening to you, Doctor, but it's a bit like trying to sort of remember everything. When you try and tell someone, then you find you can't remember everything. I mean, there's nothing wrong with the brain, but it's just normal forgetting,
So what do you understand from what we've discussed today?
Well, basically you're saying to me that, if I was very ill, would I want to go into hospital or be at home? And I said I'd much rather be at home, and that you're trying to sort of prepare me, or for me to be, prepared for, what is the inevitable thing, isn't it, and about all this, sort of bringing you back to life, so I think you know how I feel about that, really.
Thank you for being very honest, and just have time to think about it. We can meet again in a week's time.
Okay.
And be reassured that you are doing better than you were previously at the moment. So.
Well, I suppose it clears the air, gets it sorted, and then I can maybe forget all about it,
Yeah, exactly. Okay, thank you very much.
Well, thanks, Doctor.
Okay.
Thank you.